board. And we're going to go ahead and get started. So 2020 has really been a year like no other. This week, especially, we've seen the collision of two pandemics, COVID-19 and systemic racism, really bubble to the surface of mainstream America. Many of us have been working in the overlap of public health and racism for years, yet this week it seems to have the attention of the nation. Our systems were designed to oppress and marginalize Black and Brown folks in this country, and as advocates, it's our responsibility to fight for systems change. We do this legislative update wrap up each year to share information that's vital in this fight. We must know what decisions are made at the state level here in Missouri so that we can act accordingly. This information is really not that easy to come by, and frankly, advocating at the state level is difficult at best. We are joined today by folks from a variety of professions and communities and areas of passion, and we hope the information shared today will help you advocate more fiercely. And I will speak for the organizer of this event and the presenters that we are all here as a resource to you. We will make sure that you have our information so that if you have questions, comments, concerns, anything else you want to dive into deeper, we are here for you. So today we are joined by three phenomenal advocates to share with us how this year's very unique session impacts children and families in Missouri. So we are going to start today with Amy Bluen with the Missouri Budget Project, followed by Jessica Seitz with Missouri Kids First, and last but not least, we will wrap up with Craig Stevenson with Kids Win Missouri. And again, we will take all of your questions at the end, so please throw those in the chat box as they come up for you. And we will be sure to get to those and have a really lively discussion after the panelists have spoken. So I am going to hand it over to Amy first, and I'm going to share my screen so that we can get going. Give me 1 second, Amy. All right, can you all see my screen?
Yep.
Awesome. All right, Amy, take it away.
Okay. Good morning, everybody. I hope you're all doing well and staying well. I always feel a little bit like the Grim Reaper in the group where everybody else gets to talk about all of these great things that happened during the legislative session. I get to give you the down and dirty what's possibly going to happen and it's not good. So if you can, Abby, are you controlling the slides? I'm sorry, if you can go to the slide show view and then move to the next.
Is it showing up as like the presenter view?
The editing view. Okay. Let's see if we can go ahead to the next.
How do you see that, Amy?
It looks like it's on the editing view to me. I don't know if everybody else sees it that way. And it looks like up at the top you may have to click on enable editing.
You see that?
Yep. Okay, that's great. Now it's showing us. Perfect.
All right.
Perfect. Okay, so the next it's okay. The next slide, you all know this already, but I like to just say this is why we talk about the budget, right? It's about the people in the state. It's about investing in our kids and our families, and how we make those investments can create the foundation for every Missouri kid to thrive. If we don't invest in our kids, we stymie their ability to thrive in the state. So there are a lot of kids represented in this chart. The next slide shows you what those investments were that were passed by lawmakers in the new state budget, which starts on July 1st. The new state budget, as passed by lawmakers, was almost $36 billion. About 42% of that goes to social services, health and senior services, and mental health. And that includes most kids services outside of education are for the most part in those three buckets. And then education, including pre-K through higher ed, is about 28% of the total budget for the new fiscal year. The next slide, many of you have seen this before, but it's how we support our budget, which revenues are coming to the state overall to support that almost $36 billion budget. A couple of things that stand out this year in this chart that I want to mention, and you've seen this one in particular before. Missouri has a significant portion of state funding, state-based funding that's earmarked. It's about 30% of the total pie. And in the state, what that means is that even if lawmakers want to move that money around, it's mostly constitutionally restricted and can't be moved. So one example is the gas tax, which has to go to roads. Even if there was a shortfall in, let's say, education, lawmakers couldn't put the gas tax revenue over to education. The other thing that stands out in this chart is that in addition to the regular funding for the new year, we have a significant portion of federal fiscal relief. In the budget that lawmakers approved, they included about $5 billion of federal fiscal relief. That amount, and I'll talk about this more in a minute, but the amount of funding that was included for federal fiscal relief in the budget actually far exceeds the amount that Congress has approved. So even though the budget is $36 billion, which is $5 billion more than last year, a lot of that funding doesn't actually exist. And I'm going to talk about general revenue in a second, which we expect to drop significantly compared to what lawmakers approved. So the next slide talks about what was actually funded in the budget. And it just gives a rundown of some of those things that were approved for kids specifically. Pre-K through college, childcare was funded at almost $274 million. That included about $66.5 million in federal stimulus funds. It did include a $3 million general revenue cut to childcare, but it is significantly more than childcare has been funded in previous years. And you got to credit KidsWin Missouri for that and the hard work that Craig did on that with many of you working to get a $20 million cut reversed. So that was fantastic work. Parents as teachers, most of these items are flat funding other than childcare and other education funds. Parents as teachers was flat, First Steps was flat. The pre-K through 12 formula was flat funded. The public placement fund for children in foster care was flat funded. Colleges were cut by $68.5 million. Higher education, that funding will be restored if federal stimulus funds become available, which is uncertain at this time. You can't really see very well the entire slide, I don't think, but home visiting was funded at almost $8.4 million. The Children's Division has a new program for home visiting of $3 million. School-age childcare was flat funding, and then a child nutrition program with federal fiscal funds of $185 million was funded. The DD, for those of you who watch mental health, the developmental disabilities wait list was funded to eliminate the wait list. So this is all really good. The problem is that the revenue structure may not allow these things to actually come to fruition. So we, you already know that Missouri's revenue situation, general revenue situation, was dire before the crisis, right? We had last year 1.4% growth in a good economic year. That compared to the nation of 4.5%, we were well below other states even before the crisis happened. And then COVID hit, and we are now projecting, national experts are projecting that we could face 12 to 18 months more of this kind of on again, off again economy, where the economy is cycling to try to protect people. People will be are expected to be under stay-at-home requirements again in the fall. So until we have a vaccine, that's going to continue to disrupt the economy as well as our health. So that has led to significant increases in unemployment in the state. About 600,000 Missourians since the middle of March have filed for unemployment. Again, that's 600,000 Missourians have filed for unemployment. That means less people are working, less money is circulating in the economy, which means that our state tax revenue will decrease. And the revenue that we need to fund services will decrease dramatically. We projected out kind of in today's dollars, what it means for state general revenue, which is about $10 billion, what it means if we have unemployment levels similar to the Great Recession or similar to the recession that took effect after 9/11. What we're looking at is going to be more similar to the Great Recession or worse than that. The Great Recession, we had unemployment levels of 9.6%. Missouri's current unemployment level is 9.7. That was in April. Does not include the most recent unemployment figures. But national experts expect, including the Congressional Budget Office and Goldman Sachs, expect that unemployment could peak this year at closer to 16 to 25%. So we're looking at very dire unemployment levels. If we had the unemployment that we had level maintained throughout the year that we faced during the Great Recession, we would be short, our general revenue would be short about $1.9 billion in the next 2 years. So the current year, which ends June 30th, coupled with 2021, it looks like that could be what we're facing. So $1.9 billion in potential cuts. Some services will also face significant declines in gaming or in earmarked funds and local funds. Education's a good example of that. Education has pre-K through 12 has already faced cuts. Withholds that the governor implemented. The governor over the last couple of months has announced about $428 million in cuts that included about a significant cut from pre-K through 12 education of $123 million. Their gaming revenue for May it declined by $60 million because Obviously the boats were closed during the pandemic, and they also rely on local sales taxes. So instead of flat funding, K-12 education is looking at a significant drop in the funding per student. This is all happening at the same time. If you go ahead, Abby, this is all, you can move on. Sorry about that. This is all happening at the same time that need is increasing, okay, in the state. So this shows you what happened with the Great Recession. In Missouri already, we've had a jump of 7% in Medicaid and 14% in SNAP. Already we face that. So at the same time that we're having this drop in revenue, our need and demand for services is increasing. The final slide, or the second to the last slide, shows you the federal response so far. And I want to point out a couple of things. The Coronavirus Relief Fund, which is where the majority of funding is coming through to the state so far, was almost $6 billion for the state, about $817 million for localities going through the counties. That funding is very restricted. It can only be used for things that are services that are directly related to COVID and the COVID emergency. So we may be able to use some of it to fund things like public health. We may be able to use some of it to fund some state employees who are working on COVID specifically, public health folks, as well as some of the corrections officers who are dealing with COVID in the facilities. It largely can't be used to fund our budget shortfall, which is very different than what Congress approved during the Great Recession. They gave Missouri about $3.6 billion in very completely flexible funding. Without that flexible funding, we're looking at significant cuts to our budget that will end up making the recovery harder and extending our fiscal crisis even longer. So we need everybody on the next slide to be calling on our congressional folks right now for additional fiscal relief. We're starting to work on outreach to Senators Blunt and Hawley. We need two things specifically from them: an increase in the federal matching rate for Medicaid. They have approved that, but it's only approved for a short period of time tied to the public health emergency, which specifically is scheduled to end in August. And we need them to enhance the COVID relief fund and make it completely flexible. So if you can help us with that, you've got my email on the screen. Just shoot me an email and let me know. We're moving on this very fast over the next month. So that's what I have, which is all good news, right?
Thank you so much, Amy. Your advocacy moment was very much appreciated. I know a lot of people are really interested in what they can do to help. So everyone listening, that is one thing to note. Amy, are you okay with us sharing your slides with folks after?
Absolutely. Yeah, absolutely. Just if you don't mind hiding the notes, because they're not actually updated.
Perfect. We will make sure that those are good to go for everybody. So you will all get these slides afterwards, so you can have, and we'll also share emails of everybody so you can reach out if necessary. So don't forget, questions in the Q&A box, and then conversation and all that fun stuff in the chat for all those who are listening. So I'm going to hand it over to you, Jessica, and I'm going to make sure I get this slide situation correct this time. So give me 1 second.
Yep.
Perfect. All right.
Okay. Well, good morning, everyone. Thanks for joining us on this Friday. I'm Jessica Seitz, and I'm the Director of Public Policy with Missouri Kids First. And I recognize a lot of familiar names on this webinar, but if you're unfamiliar with our organization, we are the state chapter of Child Advocacy Centers and the state chapter of Prevent Child Abuse Missouri. And so in my role, I work to advance policies that address and prevent child abuse and neglect. So that's kind of the policies I'm going to cover for in the next few minutes. So I'm sad. This is one of my favorite events. This is my third session with Missouri Kids First, and it's been one of my favorite events since I joined the team. So I'm happy that it's continuing virtually, but I will say I'm sad to not see you guys in person, to not see, and to not hear. It's just, I think, a little, I'm missing that engagement. So I'm hoping that next year we're all there in person. But all right, So this year was, I don't think this is a surprise to anyone. This year was, this legislative session was wild. It ended on May 15th. There were, kind of normally, there were about 2,000 bills that were filed. Only 32 actually were truly agreed and finally passed, aside from budget bills. And so, that's obviously, that was due, the session was interrupted for many weeks because of COVID-19. So there were fewer bills that were sent to the governor. But there were 32 bills that passed. That small number is that's deceiving because of what is known as an omnibus. And I just wanted to put the graphics up there just to kind of give everyone a chuckle, and just to show you that lawmaking can be really tough sometimes. And so omnibus bills are bills that are basically a combination, just like that top graphic sees, of a whole bunch of other bills. And so the things I'm going to talk about today are all omnibuses. This year was certainly the year of the omnibus. Several passed. There were many, many more that became so large that they did, in fact, kind of cave on their own weight and didn't cross the finish line. But omnibuses, just to plug, for those of us who work in the Capitol, omnibuses can be very challenging from the advocacy standpoint. So I just want to say that it can be challenging because when you have a bill that started with 4 pages and becomes 84 pages, it can be difficult because most of that is a combination of bills that have been filed and we've reviewed, and so may have been debated on their own, but then in the middle, 2 or 3 pages can be things that you may not catch. And so as advocates, Amy and Craig and Abby can attest, it can be challenging to follow. Like what got put in this bill and the bill that I was supporting can dramatically change after one debate on the floor. And so that was even more, as an advocate, it's always challenging to follow an omnibus. There's spreadsheets galore. But it also can be even more challenging as a lobbyist or as an advocate because we were doing that remotely. So I can't say, the text messages, the screenshot. It was certainly an interesting and difficult. So, however, there were several omnibuses that did make it over the finish line. So let's move on to the next one. Next slide. All right. So the first one I want to talk through is a omnibus child protection bill. So the full title was Senate substitute for Senate committee substitute for House committee substitute for House Bill 1414. All those prefixes mean that there were a lot of versions of this bill. So 1414, which was truly agreed and finally passed, sent to the governor, contained multiple child-focused bills. There were at least 15 separately filed bills. Craig and I are going to divide and conquer this legislation. Many child advocates worked on this on different pieces. There are a lot of fingerprints. So I'm going to cover kind of 3/4. Craig's going to cover some pieces, but as best I can. So I'm going to pick out these first 4 bullets. I'm going to pick out, there were 4 different individually filed bills, and those are the numbers are there, that related to child abuse and neglect. The first bill that was passed in the omnibus was that it provides child advocacy centers employees acting in good faith with civil liability. That was actually Missouri Kids First, one of our top priorities. Child advocacy centers, so those are my members. They are 501c3 nonprofits that provide services to children with an open case of child abuse and neglect. But we had cases where there are 501c3s where we had kids that had come in for services and to be interviewed that were later sued by alleged perpetrators. And so this was a protection for child advocacy center employees, and that was really, really important. It sounds really wonky, good faith, civil liability, snooze, but it was really important. So we were really excited. Senator Riddle was the champion of that legislation because of a CAC in her district that was sued. And so that was really, we were really excited to see that go over the finish line, even though it required a lot of explaining of some of these very difficult legal terms. Then there's the creation, so actually the next two bullets, the TAPAs and the risk assessment. Background, both of those were passed as, they were recommendations that came out of a child safety task force that was a task force that released a set of recommendations around improving children's division practices as it relates to child safety. A report was put out at the end of 2019 with multiple recommendations, and those second two bullets were actually recommendations that came from that report. So we were excited to see those through. So TAPAs, Temporary Alternative Placement Agreements. This is kind of confusing, but TAPAs are creating a more formalized process for what are voluntary agreements that families place their children they're not in foster care, but they are when they need like a voluntary temporary short-term placement. And so that was just a way, TAPAs kind of create a process where those children are involuntary placements. They're not brought into care, but they are also tracked and checked on by Children's Division. So it was a way to, so that was just, and then the second bullet, or the third one there, was requiring Children's Division workers to complete a risk assessment within, that was 72 hours, sorry, not 24, 72 hours of reported abuse and neglect. That was also Children's Division used to use formally used a risk assessment. They did stop that practice. They have since renewed it by a rule change, but this would actually codify that into statute. So that risk assessment. And then finally, the last child protection related was a bill that would require Children's Division, when they receive a report of child abuse and neglect, to do their best to try to identify whether that child is their family's member of the military. So that's that. Next slide. Like I said, this bill is a beast. So there are multiple provisions related to foster care. Some are pretty nitty gritty and pretty wonky. I will say that the first one is the establishment of a response and evaluation team for foster care case management. That includes contractors, and so that'll help oversee development, placement, referrals, and payments. So that team will oversee that. It would allow foster parents access to medical, including mental health records. Let's see, foster parents, okay. There would prohibit Children's Division from requiring foster parents to conduct or be present for supervised visits with a child in their care. And then about appearance in court, that this was kind of got changed, but this is actually included in the original, I believe, 1414, which the court will only require a child to appear in court if necessary for making a decision. But the bill clarifies that the child has the right to attend a hearing. So they have the right, but they're not required. And the idea for advocates was that sometimes multiple appearances in court can be very traumatic. So the child has a right to choose, but they're not going to be required to make multiple appearances in court. So then I will make a final note that one rather controversial provision, controversial depending on the advocate that you speak with, was Senate Bill 623. That was a standalone bill from Senator Leibla that would modify the provisions around guardians ad litem, that had actually advanced very far past the full Senate, past House committee, and it was included in this bill and then actually stripped on the Senate floor. So that is just one I want to highlight because it got a lot of attention, but it did not in fact make it in the final 1414. So that's the Child Protection Omnibus, and that's only a part of it. You're going to hear more from Craig. Second omnibus I want to highlight is that we had an exciting, very bipartisan effort to pass a sexual assault omnibus. So just a few pieces. So it had this was really three big bills. So the first one would create a web-based rape kit tracking system, a statewide storage facility that I believe of unreported kits that would be kept for 5 years. And it would also create a tracking system to allow victims or their designees to track, obtain reports, and receive updates on the status and location of their kits. Then there was, centralized storage repository. There were a lot of things here. The second one was a bill from Senator Sater that would establish a Sexual Assault Survivors Bill of Rights. This legislation creates new legal rights for survivors and also creates a task force, sexual assault task force. And then the final one was a bill from Senator Shoup. Like I said, this was very bipartisan. So Senator Shoup, the standalone bill was called the Justice for Survivors Act. And that bill was something that Senator Shoup had been proposing for several years. It would work to create, subject to appropriations and some funding, we create a statewide network of sexual assault nurse examiners. And so that would work to formalize the training requirements of the medical response to sexual assault. It would also create a telesane network. And so that is something that was very innovative and was exciting to make it in. So that was a great bipartisan effort. And then next slide. So like I said, we only had a few bills that made it over. And so there were some things that prior to this legislature taking several weeks off that had moved very quickly. And I think in a normal session, we could have really, they could have made it over the finish line, but they also were complicated areas of policy that did need further debate on the floor. So on one hand, we're sad that they didn't make it over. On the other hand, we want things to be thoughtfully passed. So I just want to highlight some of the things that did not make it over that Missouri Kids First was supportive of, as well as some of our partners in the Capitol that we're hoping to work on in future sessions. So 1414 was ultimately the child protection bill that made it over the finish line. But before that, the big bill was 2216, sponsored by Representative Coleman. Now, several elements of 2616, I'm sorry to make this so confusing. I have a tracker that we will submit in follow-up materials that provides the actual bill numbers. It's the spreadsheets that I referred to earlier. But 2216, several parts of that made it into final law in 1414, but then some other pieces that did not make it in that we hope to pursue in the future are highlighted on this slide. Safe baby courts, that would establish a separate or a specialized court system for children under 3 years of age, so some of our most vulnerable populations, connecting families with services and support to promote and faster exits from court or diversion. So then the second would address the practice of schools investigating themselves for child abuse and neglect. That is a provision in law so last year, some of you who may have attended last year may remember that we had worked really hard on improving the way our schools respond to allegations of child abuse and neglect for school personnel. One piece of that this is a continuation on the efforts to improve our education system's response to child abuse. Right now, schools, even if an investigation is open, it's kind of complicated, but it would address, basically, it's a loose end that needs to be fixed. And so that's something that we will be working on next year. I also want to there was a bipartisan effort, the last bullet there. There was a bipartisan effort by Representative Dottie Bailey and Ian Mackey that would define restraint and seclusion, requiring school districts, charter schools, or publicly contracted private providers to include a policy prohibiting the use of restraint and seclusion as discipline practices in schools for any purpose other than in situations where there's imminent danger of physical harm. And it would require DESE to complete a report on this. This was legislation that was very well supported. It just didn't make it over the finish line, and it is our hope that it will make it over next year. Oh, and the second one. And finally, the one bill that I will say Missouri Kids First was very disappointed and frustrated. So that's why I said frustrated that did not ultimately pass was House Bill 1414 from Representative Solon. That passed. That was one of the first bills heard this session, removing a statute of limitations on civil cases or civil lawsuits for child sexual abuse. That legislation would continue. In 2018, we removed the criminal statute of limitations on childhood sexual abuse. This would remove the civil. This has been an effort across the country and had a lot of support, but it did ultimately get removed from the House calendar right before they released for COVID because it was opposed by insurance companies, and we were unable to reach a compromise. There were concerns. It's Missouri Kids First position, concerns that are not accurate, just to be honest, that it would impact a homeowner's liability insurance, so a lawsuit. So that's like an example, as I said earlier, of if we had had a full session, we may have been able to do some education. There are many, many states who've come before us that have passed that legislation and provided a little bit of education. But, when things get stalled and you miss months of session, you don't have an opportunity to develop that. So that is an effort that I know the Missouri Kids First will be pushing in future sessions because it's important. Thanks. Thanks for having me.
I wanted to make sure there was a little bit of time with your last slide up, so folks could maybe get your information if they wanted it before we sent it out. So, but again, we will be sending out everybody's contact information. So if you don't get a chance to catch it, we will make sure that you Greg, I'm going to pull up your slide.
Fantastic. Well, good morning, everyone. While Abby's pulling up my slides, I just wanted to add my thanks to Abby, Scenaria, and Colleen for hosting and inviting us and doing this year after year. I hope it's helpful to you. I know that it's helpful to me, and I think I can speak for Amy and Jessica, and it's always nice to get to kind of kick off. This is kind of our first format where we get to showcase and talk about what happens during session. And so I know it feeds me. And so I hope that it encourages and feeds you all as well. But if you're not familiar with Kids Win Missouri, Kids Win Missouri is a child well-being advocacy organization. As Jessica mentioned, we have many familiar faces on the call, but if you're not familiar with us, you can see our mission and vision on the screen and some of our history. We're a coalition, and so we have a lot of different organizations and individuals who are a part of our process. And I think what I appreciate about us as an organization is we pride ourselves into really leaning into the coalition aspect, where our policies that we push forward and try to pass are rooted in a grassroots effort, even though we ourselves are not necessarily a grassroots organization. So with that, I'll kind of piggyback on what Jessica started, talking about House Bill 1414. And as Jessica alluded to, I think it's important to note, there's obviously strategy that goes into how legislation kind of gets to the very end of session. And I think that it's really important that we had a couple of legislators during the COVID-19 shutdown that reached out to us as a child advocacy community, and they really said, okay, what are the most important aspects, of these bills that we've all been working on that we can try to loop into one bill? And And so I want to give them credit because I think that's a large part of why and how we got to have one of the few bills, quite frankly, that passed. So a couple of the provisions that we at Kids Win worked really hard on, and our coalition worked hard on, is related to some childcare changes. Many of you will recall last June, last spring, the governor convened what he called the governor's child care working group. And in June, they put together a list of recommendations of how to continue to move childcare forward in Missouri. And these, what passed this year is in part, not in full, but in part, some of those recommendations. And so, for example, when those leaders reached out to childcare providers and looked at their internal processes, they said, it's kind of silly that we have a 2-year license renewal process. This is a paperwork process for childcare providers. We go in, we make sure that their facilities are sanitary, that they're meeting all of these requirements. This is a paperwork busy work type thing, let's eliminate it. And so we were able to get that included in this bill, and is now hopefully, if Governor Parson, assuming he signs the bill, will become law in August. It updates, it does some things that probably are not that attractive, but updates and streamlines some of the list of crimes for those who are ineligible and really streamlines those. So a part of the problem that came out in the childcare working group was that childcare providers who were both licensed and subsidy providers, that they actually had to have their staff do background checks twice. Because the two state departments didn't communicate and didn't have a mechanism to communicate. And so what we did in statute with this bill is both aligned those crimes to make sure that they were what DSS on the subsidy side and what licensing is looking at in DHSS are the same crimes, but then also streamlined who's responsible for those background checks to eliminate the need for a childcare provider to have their staff get the same background check twice. And as obviously there's a cost associated both administratively to do this, but then for the provider, these are roughly $40 to $45 background checks a piece. And so that is real money to folks. So we were excited that that was included in the bill. And then the second thing that I wanted to touch base on here was the stuff we're really excited about. Kids Win convened a group of folks interested in youth homelessness and trying to figure out what are ways to help those youth among us who are homeless or experiencing homelessness. And so Abby, on the next slide, it has some of those provisions. Thank you, yeah. And we're really excited. We had kind of a fairly long list of asks, and Representative Patricia Pike and Senator Bill White were our lead folks here. But really, we got almost everything we were hoping for. You can see here that we added that youth who are homeless can now obtain mental health services. So before they were not able, they could contract with health providers, but mental health services was not included in that statute reference. And so we added that to that statute. Obviously, if someone is homeless, if a youth who is homeless, to get a job or to get anything, a driver's license, they need a copy of their birth certificate. But if they're still a minor, they may not have access to a parent or guardian to sign to get that. And so it allows access to a free copy of their birth certificate from DHSS, which is really an exciting, it seems like a mundane thing, but is really exciting. Subject, I think it's really important to note that a component of folks who are maybe missing out of healthcare benefits are homeless youth who are 19 or 20. And so what this would do is subject to estate plan amendment approval by the feds and appropriation as well, that this would expand Medicaid eligibility for a youth who is homeless and is 19 or 20 years old. So trying to really make sure that these young folks have access to healthcare to make sure that they remain healthy and able to have access. A couple of kind of cleanup things that were done to really help clarify for the advocates and folks who work with those who are homeless is that we expanded the certification process. Obviously, if a youth who is homeless needs a service and goes to, say, a healthcare provider, oftentimes that healthcare provider may say, I need to prove that you are a true unaccompanied minor, or you're truly a homeless youth. And so a letter will be now sufficient from a nonprofit that works with the homeless population, the school district, a local education agency, or an attorney representing the interests of that youth. And so that's an important component. And then some of the, as a provider, to make sure that you're doing and are encouraged in a lot of ways to provide these services. They were asking for immunity as long as they were acting in good faith. And so I think the fear was that if they provide health services, right, to a youth who is homeless, but then a parent or guardian comes back to them and says, they're not homeless, you shouldn't have done this. If they can show that they acted in good faith, they would be immune from civil or criminal liabilities there, which is important to make sure that, again, that our youth who are homeless have access to that. So those are the two other provisions in 1414. There was a bill, one or I think two, maybe a second bill that kind of touched on healthcare, but healthcare policy, there was an omnibus bill, 1682, House Bill 1682, that changed and added provisions around healthcare. And so I wanted to highlight for you some of those provisions which interact with children. There you can see that there were several designations for health awareness, which we at Kids Win and our partners, we know we will promote these as time goes on, because I think that any opportunity that we can talk about mental health or minority mental health or infant and maternal mortality is a good thing. And so the legislature recognizing that the importance of highlighting these months and these issues is important. You can see that one of the provisions requires CPR trainings to include the proper use of an automated external defibrillator. My understanding from going through my own CPR training is that at least my training already encompasses this, and so I don't think this is a large change, but still an important aspect as more and more areas and buildings across the state have access to an AED. The underlying bill, the bill that started all of this, that the omnibus bill is built on, if you will, is this idea that it would ban we should ban the use of vapor products in schools or on school buses. And so that was the original underlying bill from Representative Wood that everything else was built around. And so obviously that impacts children in a big way. The bill has several provisions around marijuana use and marijuana products, and so specifically related to children. It prohibits the shapes of some of those products to be appealing to children or youth, such as shapes like humans or animals or fruit, or specifically called out in the statute. It does not prohibit geometric shapes, like a typical geometric shape, but anything that could be resemblance, like that a child would want to try or not know what it could be. It would prohibit that. And then lastly, and I think really kind of the most important for those of us in the child and maternal health space, the bill included on the Senate floor an amendment from Senator Shoup that is the Postpartum Depression Care Act. And essentially it does a couple of different things, but it encourages providers to invite women who have had a child to complete a questionnaire to detect symptoms of postpartum depression. And then it would require, and I think, again, this is done in most instances, but putting in statute require that prior to discharge, that a hospital facility provide information around postpartum depression and the risks that there are for that. But really exciting, again, pending federal approval, this would allow pregnant women who received treatment within the 60 days of giving birth for postpartum depression. It would actually extend those mental health services for up to 12 months. And that's a huge deal to make sure that as women come out of the birthing of a child and had symptoms, to make sure that that care is able to be continued, and after the 60 days, they're not just dropped like cold turkey kind of thing. So a huge thing, and we hope that as we all in the advocacy community now look at what passed, are in a lot of ways our advocacy changes to how to implement. And so we'll be working with the department to make sure that they ask for this waiver, and look forward to seeing that being developed. Similarly to Jessica, I wanted to touch on what didn't pass really briefly. We at Kids Win worked with the Missouri Budget Project and the Missouri Coalition for Children's Agencies and many of our colleagues around the idea of 12 months continuous eligibility for children. That bill didn't pass, but I'll come back to that in a minute. And you can see a couple of the other things that didn't pass. Specifically, I want to call out here what did not pass was additional burdens for those receiving SNAP or Medicaid. It's a big deal, and our advocacy community is truly the reason why that those bills didn't come to fruition. I want to touch briefly on COVID-19's impact to Missouri policy for us before we open it up for questions. Obviously, we all know there's been a lot of flexibility given to states from the feds, and the state has done a lot around the pandemic-related assistance. And this list is just, it's not all-encompassing by any means, but a couple of the things that I wanted to highlight. And whether that be expanded eligibility for childcare subsidy or 12 months continuous eligibility for those children who are on MoHealthNet. We were pleased that the Department of Social Services and MoHealthNet recognized the importance of that during a pandemic. And so, so those are some of the waivers and just things that have happened that have helped families in this really trying time. And so I think it's important for us as an advocacy community to recognize and be thankful for the department. While some of these things maybe didn't move as fast as we hoped or would want, it's important for families and children that we work for and around. And lastly, I think, oh, I have one more slide here. I did want to, and Amy alluded to this in a lot of ways, the pandemic-related economic impact. And I just think it's important to kind of know where our programs stand. And so I won't belabor this because Amy touched on this, but you can see the numbers of whether it be the number of families who have increased the utilization of food stamps, or the number of children, new increase of children on MoHealthNet. These are really important things to keep in mind as we look ahead, which is my final slide. Really, one of the things that we as an advocacy community will have to begin to do and balance is follow the processes as state and federal emergency pandemic waivers expire. We know that as these expire, the need will continue for a long time. We know that as the assistance declines, there will likely be more need to have more and more of a presence in the Capitol and to policymakers to show the need. And so we'll be watching. We won't be alone. We'll be with you all to do these, and we won't obviously take the lead in all of these things, but these are things that we're watching, whether it be the impact of the child welfare system. The number of kids in foster care has remained pretty constant. But as we come out of the pandemic, I think a concern that we have is, let's be real, in the pandemic, because in-person visits haven't happened, kids have not been exiting the foster care system at the rate that they normally would. And we would expect that as we reopen, we'll likely see more kids coming into the system because we know that times of family stress, abuse, and neglect happens. So we will be watching that. As Amy alluded to and talked extensively about, the budget advocacy will be more and more important going forward in this as well. So I just wanted to highlight that as we know that this is kind of, it's for advocates, we typically have kind of a long-term vision. Hey, what do we want to get past? But I know that we as an advocacy community are looking at both the short, medium, and long-term effects of what the pandemic offers us. So that's all I have. Yeah, well, thank you. There's our information. So, yeah.
All of you for this awesome information, and we'll be sure to share all of this in the follow-up email. So I'm going to turn it over to Colleen to kind of facilitate our Q&A. We have a couple of questions that came in.
Good morning, everyone. Just want to echo everybody. Thanks for your attendance, and then to our panelists who have provided us so much information, not just this year, but overall the prior years as well. And thank you very much for continuing to come back to give us this information every year. Before we get started with the Q&A, I just wanted to let the participants know that this session has been approved for CLE credit. So for our attorneys in our group, it will be listed on the Missouri Bar website under the St. Louis Child Abuse and Neglect Network. So you can get some of your hours through this presentation. So we do have a few questions from our participants. The first one is mostly directed at Amy, but anyone could chime in and add to it. But this person is curious about advocacy that we can do around SNAP benefits and talking with our senators about increasing the percentage that we have for SNAP benefits. I'm sorry, can you not hear me? I see Amy leaning forward, so. So I was saying that our first question is more directed towards Amy, and this person is curious about SNAP benefits. And Amy, when you were talking about the advocacy that we can do for our senators and how we can reach out to them, what would your suggestions or thoughts be about increasing SNAP benefits and how we could advocate for that?
So I think that Colleen, we're still struggling to hear you, or most of us are. I'm sorry, but I think that you're referring to Jeanette Mon-Oxford's question about SNAP and increasing. Also, when people are advocating for, in addition to advocating for fiscal relief, to advocate for a 15% increase in SNAP at this time. And I'll just speak for Jeanette for a minute, but she can, I don't know if she can actually talk to the group, but from what I've learned from Jeanette, who is at Empower Missouri, who's taking lead on SNAP advocacy, you know, a 15% increase in SNAP at this time of pandemic and crisis and through the economic recovery is critically important for families, puts money directly into our local communities, helps make sure that kids have access to the nutrition that they need to thrive. So in addition, that is something that they did after the last or during the last recession that Congress approved. So in addition to fiscal relief, we are definitely hoping folks will ask our congressional delegates for an increase in SNAP funding too, of 15%.
Thank you, Amy. Jessica or Craig, do you have anything that you would want to add to that? Amy's covering it, of course.
Go ahead,
No,
Jess.
Amy did a great job.
All right, thank you. So the next question that I have is, Craig, when you were talking about, and Jessica, when you were talking about some of House Bill 1414, and especially with the homeless youth aspect, you talked about some of how we can determine if a youth is homeless and those avenues for that. I just had a very basic question on what the age is for these kids and youth.
Yeah, it's a, it's a great question. The statute references the age of 16. And so, and we as a coalition have looked at that, and I think long-term would like to, as we see more and more youth who are leaving families who are unstable at younger ages, but that's a really hard conversation to have in the legislature. So the current statute references the age of 16 and usually references a youth who is homeless using a school definition, the same definitions that the K-12 schools have. So that's kind of how it's defined, and that's the definition that we've been using at Kids Win. And for example, that definition is typically pretty broad. A youth could be homeless if they are, or their family is, doesn't have stable housing, and for example, is couch surfing or living with a grandparent or something like that. So it's a pretty broad definition, is how the education definition is under the McKinney-Vento Act definition.
Great, thank you. Jessica, did you have anything to add to that?
No, Greg did a great job.
You're all so smart. It's just, yeah. So smart. Another question we have just around some of these new awareness initiatives that are coming through that you all have talked about. And so things like Mental Health Awareness Month, and Minority Mental Health Awareness Month that we've talked about. How do we anticipate that those things could be celebrated? How can we make sure that we are making these a priority within the advocacy community? Jessica, do you want to start since we haven't gotten to you yet?
Yeah, I mean, so I was not familiar with the efforts that were included in the Health Omnibus bill, so I don't know the specifics of who actually championed those provisions. But I can say that these are awareness efforts, right? And they are they're just that's essentially the legislature endorsing this area as something that is important to raise awareness on. So I think the way that they are elevated varies by basically the level of passion for the topic. So what I would encourage folks to do if they're interested in, elevating Mental Health Awareness Month or really taking on the different initiatives or the different awareness is to identify the legislator who championed that through, find out the different organizations that supported that bill, either by reaching out to the legislator or looking at the bill number and seeing the organizations that testified in support, contacting those organizations and those champions and finding out how they are planning to implement it. And then offering up yourself as a partner is what, that's kind of where I would start. Find out a little bit more about the issue, figure out your own organization or you as an individual, why you prioritize it, and then get together and form a coalition. That would be my recommendation. If those actions are not taken, which is why I would encourage you, if you care about those issues, to get involved, they will fall along the list of unrecognized awareness days that have passed before.
Thank you, Jessica. Craig, did you have anything you'd like to add? All good?
All good.
All right, great. Another question that I have is, and I remember this from last year's session that we had also, that there are several pieces of legislation that the state will pass but require some kind of federal approval or appropriation or waiver from CMS or something like that. So while we've passed it, we can't really implement it until the federal government gives us the okay and the appropriate things that we need to do so. So how do we track that and advocate to make sure that the departments that are supposed to be working on implementing these different initiatives are taking the necessary steps with the federal government and that is moving along?
I would punt it to Amy. Amy knows.
Can you repeat what you were saying.
Sure. So for
Repeat the
those,
question.
yeah, for those pieces of legislation that the state has passed but require some kind of federal appropriation or a waiver from Medicaid or something like that for us to be able to implement, how can we as advocates ensure that the departments within our state that are supposed to be making those things happen? How can we monitor that
Okay.
and push that?
Right. Okay, great. So that's a great question. So one of the things, one example of this that you're talking about is what Craig mentioned with the 12 months continuous eligibility, or I'm sorry, the 12 months postpartum coverage for moms who have been diagnosed or have, symptoms of postpartum depression. That will need to go through a waiver approval process from the Centers for Medicare and Medicaid, and the Department of Social Services will need to submit that waiver request. So in order for that to, or if folks want to advocate for that, the first step really is to connect with the department. The department will, the Department of Social Services will draft the waiver request, will submit it to CMS, and then there oftentimes is a process where you can submit comments on waiver requests as well to the federal government. And then you have to wait for the approval. So that's a process. And then it has to be integrated into the state budget. So in this instance, it would be part of the Medicaid budget. Medicaid budget tends to have some flexibility in it just because the need can change over a year. And, as soon as the waiver is approved, that should be able to be implemented in this case.
Thank you.
Yeah.
We have another question about mental health and mental health awareness. And we're going to give this one to Jessica. Where can we find some data to support Mental Health Awareness Months so that when we are advocating, we can back it up with the available data for our communities?
Yeah, so I'd recommend, where I'd recommend is checking out Department of Mental Health, so our state agency over mental health, as well as I would take a look at those organizations that is their mission, and so they're the ones who work in partnership with DMH. So I would check out the National Association of Mental Illness. I would check out their website. They are big. They're kind of the leaders on Mental Health Awareness Month, which I believe is the month of May across the country. So I'd check out NAMI because I think they're probably a clearinghouse, and they might be able to connect you with those in Missouri. So that's both with the data and then efforts that are ongoing.
Great, thank you. All right, so I think that is going to wrap up our Q&A portion of this. What I'd like to do now is just give each of the panelists just a minute or two to just give any kind of closing remark or wrap up that you'd like to share with the participants. Amy, would you like to go first?
Sure, yeah. First of all, thank you all for being here this morning. Thanks for listening to us struggling with Zoom. I appreciate your time. We've got a lot of work ahead, but I think that what we've seen is that, as we advocate things do happen, right? Good things happen. There were good things that happened in this legislative session for kids. And I think we need you all now on the federal work. So, thanks.
Great, thank you. Jessica?
Sure. So thanks again for having us here this morning. Look forward to seeing everyone in person again. But the one thing that I want to put on everyone's radar that Missouri Kids First has been working on, or really I have been working on at my organization kind of while we were trying to wrap up, is that Missouri Kids First, we are very concerned by the decreased reports of child abuse and neglect that has happened during COVID. And so kind of as a response, we developed a campaign called Essential for Kids. And there's a link to that on our homepage, or you can also go to MissouriKidsFirst.org/COVID. We have a lot of resources that we've put out for the general public, for essential workers, and for school professionals around recognizing and responding to child abuse and neglect, because the decline in reports on child abuse actually was, I think, a historic low in April of 2020. It calls down by over 50%, while there were also some other alarming trends of increased incidences of severe physical abuse. There's been a national effort to raise awareness on increased likelihood of sexual abuse. And so there's just been a lot of resources that we've put out on our social media. We are going to be continuing that campaign. It's not just going to be focused on COVID, but it's going to be focused on, we're kind of doing a campaign reboot in 2 weeks, just around responding to child abuse during a time of social distancing. So I just want to put that on everyone's radar. That is something that we are actively working on, ensuring that our system meets the needs of our kids during this time.
Great, thank you. And for the panelists, again, we'll be sharing all of our, for the participants, we'll be sharing all of our panelists' information, their contact information, and their organization's information after this meeting, so you can access those resources. And Craig, you want to wrap us up?
Yeah, I just would add my thanks and kind of just one last thing to say what's next or what to expect to happen over the next couple of months. The governor typically will sign bills in July. So whatever has passed, sign or veto bills in July. Veto session is in September. I would expect a special session, if there is going to be one, to coincide with this, to work on any sort of budget stimulus that may or may not come through. And then lastly, just to kind of piggyback on Amy, right now is really critical to reach out to the federal delegation on support. The federal congressional calendar would be June and July are critical timeframes. Congress is typically not in session in August, and we know that there is an election in August, and we know there's an election in November. So as much time as they will be spending lots of time in the state. So June and July are critical for the next stimulus package to get worked out. So just would plug that for JMO and for Amy and our federal advocacy work that we do, and just would say thank you.
Great, thank you. And thank you again to all of our panelists for joining us. Now we're going to turn it over to Sonaria to wrap us up.
Thank you so much, Colleen. Good morning, everyone. My name is Sonaria Suleiman. I am the Executive Director for Vision for Children at Risk. First, I would like to thank all of our panelists, Amy Bluen, Jessica Seitz, and Craig Stevenson, for their time and the valuable information that you all shared with us. I think I heard all of you saying that you looked forward for this event, for this legislative wrap up and be a part of it. And I wanna say, we thank you, we look forward for your session, and we knew you guys will be sharing wonderful information with all of us. So thank you again. I also would like to thank the co-sponsors, Generate Health, the St. Louis Child Abuse and Neglect Network, and of course, VCR. A big thank you to all of the participants for taking time and being part of this event, and for recognizing that advocacy and public policy plays a vital role in the lives of our children and our families, especially those that's most impacted by generations of injustice and inequity. As some of you might already know, VCR, we just released the 11th edition of the CMSL Data Book. As a thank you note today to all of you for participating, we will be sending you a print copy of that book. In this new edition, you will, after seeing it, and maybe some of you already saw it because it's already posted on our website, you will see that in this new edition, the report painted a picture of the wide disparities and inequities that exist in our region. We have so many wonderful organizations just like you, providing a lot of great services, but in spite of all of that, we see that inequity continues. So, and the current outreach around the world, the nation right now, it is really a call for all of us to do more. So we hope that you use the information in the CMSL and that you use it for advocacy and for racial equity. Also, we encourage you to please continue to engage with the speakers organization. The slides will be posted on the VCR website. That way you'll have access to that information. Finally, you'll all have an opportunity in August to vote for Medicaid expansion. Please do everything that you can to educate your board, your staff, your colleagues, and the people you serve. Encourage them to register to vote and to vote in August. We really cannot afford to miss this important opportunity. I have to say that after this call, you will all receive a survey link, the survey link. Please make sure you fill it out. We use that information to make sure next year we will do better. I think that is it. I just wanted to say thank you so much, everyone, again. Please take care. Please be safe and have a wonderful day.
Thank you.
Thank you.
Bye, everyone.
Great day, everybody.
Thank you.